So what we've done is to divide this basically into two nights. And so over the course of tonight, we're hoping that you will learn more about concussions, the causes, diagnosis, symptoms, and recovery course. And then during session 2, so next week, Thursday night, same place, we'll be reviewing in more depth what affects recovery from concussion, and also speak more about some strategies that may be helpful in terms of coping. So as far as tonight, what we're going to be doing is doing a bit of an introduction, talking about the diagnosis and immediate symptoms. We're going to be taking what we're calling a bit of a brain break, and we're going to introduce a couple of different strategies that we have been using in the program, as well as in a research project that's currently ongoing. We'll also be talking about more persistent symptoms as well as recovery and outcome. And then a bit about the media and symptom management and prevention, and then we'll end with the question and answer period. Okay. So in terms of the issue, concussion disorders, basically they include the transient effects of a single concussion at one end of the spectrum to cases where symptoms can persist for a longer period of time. And it's estimated that there are about 150,000 concussions in Ontario per year. And these, as you probably well know, occur as a result of things like falls, sporting injuries, motor vehicle accidents, assaults, work-related injuries, amongst others. And what we know is most people that suffer a single uncomplicated concussion typically make a rapid recovery. But what we also understand is that there's about 10 to 15% of individuals that have a concussion that may sustain symptoms that last longer and may extend beyond sort of the normal 3-month period. What we also know is that multiple concussions, particularly if they're sustained before the brain has had a chance to heal from a prior concussion, put you at increased risk for more persistent symptoms. What we also want to get across at this point, unfortunately, is that at this point in time, there really is no accepted standard care of treatment. There's no cure or sort of magic bullet in terms of treating concussion at this time. But we'll talk more about that.
I would like to provide you with a very basic overview of the brain that will help you to understand better what happens exactly during the concussion. About some simple facts about the brain. The brain weighs about 3 pounds, the soft and slippery, the consistency, I'm talking about the consistency, with about 200 billion nerve cells and 1 trillion supporting cells, including glial cells, astrocytes, oligodendrocytes, and with a very rich blood supply and dense network of blood vessels. The brain is protected by the skull and 3 layers, including dura mater, arachnoid, and pia mater. And within the skull, the brain floats in cerebrospinal fluid. So the brain moves in the skull when concussion happens. It's jostled. It's very important during concussion. The brain includes 2 parts, gray and white matter. Gray matter is consisted of neurons, dendrites, and supporting cells, and also capillaries. And the white matter are mainly consist of axons, very long axons, especially myelinated axons, and because of the fat component, it looks lighter, so we call it white matter. And white matter is very important in it's like a transition system in the brain. Let's talk a bit about neuroplasticity. Our brain architecture is changing in individuals' lifespan and during different parts of the individual's life. We have synaptic neuroplasticity and non-synaptic neuroplasticity. The non-synaptic includes the neurons. New neurons can be created, which include those changes in the gray matter, which are mainly consist of neurons. And also synaptic neuroplasticity, which includes white matters, which are mainly the tracts in our brain. So these connections can be strengthened, weakened, or even new white matter connections can be made. Those changes are triggered mainly by our experiences, even daily experiences, and also by our thoughts, by memories, new memories, any registrations, recalls, and any mental or physical activities. So this is the reason why brain architecture is different between individuals, and also it's from day to day during the life in one individual it can be different. The architecture can be changed. Cognitive reserve, something that is very important. It's the extent to which a brain can compensate or can adjust itself to the trauma or to any injury. And it's very dependent on the neuroplasticity. The brain can be like a complicated highway or any transit system, as we see in the picture. When there is a low cognitive reserve, the ability of the brain to compensate in face of an injury is low. But when there is high reserve, more complicated, more tracks, more connections, the ability to compensate in concussion patients, in any type of brain injuries, is high. And cognitive reserve is built up and is during our lifetimes, and there are many different ways in order to augment or enriching these cognitive experiences, such as learning new things, education, employment, social interactions, and even some hobbies including music, reading, languages. All new things can enrich this cognitive reserve, and also healthy lifestyle, which is very important, including the diet, the stress management, sleep, and physical activity. It's very important that our brain to be engaged and challenged to have the high level of cognitive reserve, because after the injury, this cognitive reserve can help us to adjust with this injury, and it's very important to replenish this cognitive reserve buffer. What is a concussion? There are different terms, different complaints. In the past, we have a wide range of words for the concussion, and especially sport-related concussions. When they explain their complaints, they say bell ringer, seeing stars, daze. And sometimes a mild traumatic brain injury is substituted for the word concussion. But what is a concussion? It's temporary and immediate alterations of the mental function due to the trauma. But it doesn't necessarily mean that you should have loss of consciousness. It doesn't mean that there should be a direct hit to the brain or to the head, and also we can find nothing on the brain imaging, including CT, MRI. There are different types of forces that can cause concussion. The mechanism of concussion, they can be different types of forces. One of them is acceleration, deceleration, which is a direct contact and a whiplash injury. And the other one is rotational, which means a sudden rotation of the brain that can affect more the white matter, those tracts in the brain. And the recovery is more prolonged after this type of concussion, which is caused by rotational forces. And sometimes the concussion is a mixture of both. can be caused by both acceleration, deceleration, and rotational forces. There is a video I want to show you which explains more what happened during the concussion.
A concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes your head and brain to move rapidly back and forth. This sudden movement can literally cause the brain to bounce around or twist in the skull, stretching and damaging the brain cells and creating chemical changes in the brain. What you might not know is that these chemical changes make the brain more sensitive to any increased stress or injury until it fully recovers.
Plastic, it's like a jello mold, and it wiggles around. In a concussion, your brain changes shape very quickly. A really sensitive area of the brain is the white matter, where all these nerve fibers travel from one part of your brain to another, allowing your brain to communicate. In a concussion, these axons get quickly stretched, and that causes injury in a very unique way. If I kind of make a cylinder and I pull it apart, it just gets thinner and thinner. The same material, if I apply this very dynamic stretch, it's how fast I stretched it and it broke. And that rapid stretch doesn't break these nerve fibers, but can damage parts of those nerve fibers. So they're like a garden hose, and inside are railroad tracks called microtubules that transport material back and forth throughout the axon. And if you break the railroad tracks, all transport stops. It's like the train car just fell off the tracks there, and everything can pile up. For example, these very sticky, glommy tau proteins, and over even more time, the rest break because of a chemical destruction of those microtubules. If you disconnect these axons, they're gone forever. You can function without quite a few axons at a certain point, but you're at a disadvantage.
Now we are going to review what happened during the concussion in the brain. There are some immediate and short-term effects. These mechanical forces that I talked about, those rotational and acceleration, deceleration forces, they can damage brain structures, including neurons, axons, gray matter, and white matter. Especially white matter are very vulnerable to those injuries. There is an increase in metabolic activity of the brain right after the concussion. So the brain goes to a hypermetabolism state. And also, on the other hand, there is reduced cerebral blood flow. So we see energy crisis because there is a mismatch and discrepancy between the supply and the demand. The supply is low and the demand is going high because of the hypermetabolism state. And because of some injuries at the membranes of the neurons, there are some ionic changes. Ionic changes, for example, the potassium ion comes out of the cells, and the calcium goes inside and accumulates inside the cells. So it starts the next step in the concussion, which is the long-term effects, the inflammation and oxidative stress. And this can affect the white matter communication system. There are some disturbances in the cerebral autoregulation, especially our brain cannot maintain that stable rate of perfusion because of this mismatch. And also, there are some stimulating neurotransmitters that they're just free and they can damage the brain. That's why that sometimes after the concussion, in patients with post-concussion syndrome, when they are overwhelmed with too much mental and physical activities, their symptoms get worsened. The reason is that the demand is higher than the supply. The immediate symptoms after the concussions, there are different types of symptoms, and these symptoms are not specific to concussion. They can see in other injuries. And not everyone has all of these symptoms. For example, physical symptoms like pain, which is very common, seeing stars, headaches, dizziness, and sometimes immediate seizure after the concussion, nausea, vomiting, unsteadiness. Sometimes we have cognitive symptoms, including confusion, amnesia. This amnesia can be included the events even before the concussion and even the time after the concussion, 2 types of amnesia, and loss of consciousness. So there are some cognitive symptoms and also some emotional and behavioral symptoms, including anxiety, anger, control problems, and irritability, some mood issues. They can be an immediate symptoms after the concussion. And how do we know that someone has a concussion? It's very important to talk with the patient and have a very good history, because the history is very important about the symptoms and how happened. We can decide and if this is a concussion or not. The neurologic examination is very important. A complete neurological examination is a part of diagnosis of concussion. Neuropsychological testing. Other tests that we do, for example, neuroimaging, such as MRI and CT, mainly MRI because MRI shows the details of the brain. CT is just for very emergent cases in the emergency, not for the later follow-up. But the MRI can show the brain in details. We just want to rule out other traumatic brain injuries, and if there is any evidence of blood or in the long term hemosiderin, which is a deposition of the blood before, we do MRI, we order MRI or neuroimaging in order to rule out other traumatic brain injuries. And now researchers are looking for biomarkers and also some PET scans in research studies. So, yes.
Thank you. Just for those of you that came in after we started, just so you know, we've put some yellow sheets on your chairs, so if you have questions throughout the presentation, you can just write those down, and we're going to be doing questions and answers at the end. So we're going to just kind of switch gears for a few minutes. This is what we've termed our brain break, and we're going to be introducing a couple of different strategies that people may find helpful in terms of dealing with the different types of symptoms that can occur after a concussion. I'm just curious, has anyone in the audience, have they heard of mindfulness meditation? Has anyone taken a course or currently doing it? Okay, great. So for those of you that haven't, mindfulness meditation has basically been defined as paying attention in a certain way, on purpose, in the present moment, and non-judgmentally. It's something that helps to teach us to clear our mind, quiet our emotions, and calm the body. And there's been a lot of research going into mindfulness meditation to see what is happening. And some of the studies that are particularly interesting is that they have looked at people before they've taken a structured mindfulness-based stress reduction course. And what these are, it's an 8-week course that is quite structured, and you attend a group once a week, and then you engage in regular daily meditation homework, which is typically ranges from about 45 to 60 minutes a day. So it's fairly intensive. But what this tends to be the protocol that they look at in research. And what they've done is they've looked at people before they participate in the 8-week program. So they've put them into an MRI scanner, looked at their brains, they've looked at them functionally, structurally, and then they've looked at them again post 8 weeks in those individuals that have completed the program. And what they're actually seeing are changes in the brain as a result of people engaging in meditation. And they're seeing improvements in things like better stress, coping with stress, improvements in mood, improvements in some areas of cognition, in particular attention, concentration. There's a structure in the brain called the amygdala, and they've focused a fair bit of attention on this because what they found, it's that structure in our brain when we're really upset or we're worked up. It's the thing that is kind of going off. And what they have found is that in individuals that are engaging in this meditation on a regular basis, they actually found that the structure was shrinking. So there's some really interesting, it's not definitive yet, but it's something that we have been using in our research protocol with some of the professional athletes that have had multiple concussions, with good, reported anecdotal evidence in that case. So what we thought we would do is to actually have you engage just in a very, very short 3-minute breathing exercise. So hoping this will work. So if you want to just get comfortable, put both feet on the floor, and I'll see if I can pull this up.
Mindfulness of breath. 3-minute breathing exercise. To prepare for this exercise, just take a few moments, whether you're sitting or standing, just to find a comfortable position. You may choose to close your eyes or keep them open. If you're feeling a bit tired, it may be useful to let just a little bit of light in to keep you alert. Begin by gently moving your attention onto the process of breathing, simply observing each breath as it happens, whether you focus on the rise and fall of your chest or abdomen, or perhaps the sensation of the breath as it moves in and out of the nostrils. Are the breaths deep or shallow, long or short? Really feel what it is like to breathe, without feeling the need to alter your breath, just observing it as it happens. As you engage with this exercise, you may find that your mind wanders, caught by thoughts or by noises around the room or bodily sensations. When you notice that this happens, know that this is okay and that our mind often wanders. Simply notice what has caught your mind's attention, then gently bring your focus back to the breath. You may find as you watch your breath that it begins to change, or stays at a steady pace. Whatever your breath is doing, just watch it in this moment and feel what it is like to be breathing. Again, if your mind wanders, it may do so many times. As you notice that your focus has moved from breathing, you may wish to simply label the distraction as thinking, or as a feeling, or as sensations or noise. Then just gently bring your attention back onto the process of breathing. As we move towards the end of this short exercise, I invite you to allow yourself to be really aware of your next few breaths, focusing on every sensation as the breath comes in and as it flows out. Take a few moments to yourself just to feel really connected with the present moment. Now, as you feel comfortable to do so, you can expand your awareness from the breath into the rest of your body and the room around you. And when you feel ready to do so, you can open your eyes and bring the exercise to a close.
Week. So Dr. Trazi talked about the immediate symptoms of concussion. Obviously, in some individuals, and probably many of you here, are dealing with more persistent symptoms. And again, injury to the brain, because the brain controls absolutely everything about us, physical, cognitive, emotional, our personality. When you have an injury, you can see changes in any of those areas. And both single and multiple concussions can result in persistent symptoms. But certainly the likelihood of more persistent symptoms seems to be more apt to happen if you've had multiple concussions, and especially if you've had a couple in quick succession. From a physical point of view, certainly headache is a really common persistent symptom that we hear about. People may struggle with dizziness, ringing in the ears, changes in sensation, balance, light and noise sensitivity, amongst others. But what's really important to remember too is that these symptoms are not specific, right, to concussion. So, if you just go out and poll someone, a number of individuals that have not had concussions, they may have many of these symptoms as well. So it's important always, if you are dealing with persistent symptoms, to have them investigated to ensure that there's not some other cause. In terms of the cognitive issues that can happen, often people will have difficulties with their attention, with their concentration, with memory, planning, organizing, and again, there can be different reasons why people may have cognitive problems. So you can have cognitive problems as a result of a brain injury or concussion, certainly, but it's also important to know that some of the symptoms, for example, that might come if you're not sleeping well, if you're dealing with a lot of pain, those things can very much impact on our cognition and our ability to pay attention and remember as well. So it can be a somewhat complicated picture trying to figure out what is the root cause. Another common set of symptoms are more emotional and behavioral. So people may find that they're more irritable, they get angry more easily. Depression, anxiety are common, depending on the nature of the injury, post-traumatic stress. So there can be a real variety of different types of emotional symptoms, and these are really important if you are dealing with these to get them addressed, because if they aren't addressed, they too can spill out into other areas, including your thinking and cognition, and certainly impact on your functioning day to day. In terms of changes in mood after concussion, you can see quite a range. So just from mild irritability to more severe depression, and even suicidal thoughts and that kind of thing. And certainly the research has actually been supporting the fact that there's increased risk of suicide in individuals that have had a concussion, so and certainly with multiple concussions. So it's something, again, that is really important if you're having these issues to talk to someone, to get a referral, to get help with that. And the good news is that there are treatments in terms of addressing mood-related issues. So in terms of, so I was talking about how, there can be different types of causes. So it's also always important to make sure that you've had a thorough evaluation to rule out other injuries that could be contributing to your symptoms. For example, headache. Maybe there are issues with your neck, orthopedic injuries. Looking at medications that you may be taking, psychological issues, pain, sleep. All of these things can cause a variety of different types of symptoms. Post-concussion syndrome. So this is a term that is sometimes used for individuals that are struggling, usually beyond the 3-month post-injury mark. And there have been different definitions provided for this, but generally there needs to be obviously concussion or trauma to the head, often difficulty with attention, and then some additional symptoms as well as problems just in terms of functioning, whether it be socially or at work or at school. So this is always the big question, is how long are my symptoms going to last? And unfortunately, we don't really have a good answer because everyone is different. Again, as we had talked about earlier, most individuals that have a concussion, the majority of people make a full recovery and do well. But again, there's this sort of smaller percentage of individuals that have concussions that don't make a quick recovery and that go on to have more persistent symptoms. In terms of the cognitive effects, usually those are seen, the research suggests that those are strongest within the first few weeks post-injury. And certainly some symptoms can last longer, 1 to 3 months. Complete recovery can take as long as 6 months to 1 year, or even longer in some cases. And certainly over the course of the time that we've been doing the workshop, certainly there have been, people that have had, well beyond a year where they're still having symptoms. Again, it is the case that if you've had multiple concussions, that is more likely to be the case. So the question becomes why? Why is there this, smaller percentage of people that go on to have more persistent symptoms? And there are studies looking at this. And so there have been suggestions that there are factors that may place people at higher risk of more persistent symptoms. So things like pre-existing psychological or physical health issues. So if you're not in good health, medically or psychologically, there may be more of a chance that you're going to have persistent symptoms. They've also found that just in terms of people's initial symptoms right after the concussion and their level of psychological distress tends to predict longer recovery. Difficulties with memory and executive functioning, diminished social interaction, loss of consciousness, all of these things have been identified as potential risk factors for prolonging recovery. So this is the second strategy, and this is something else that we have been using in our professional athlete study in terms of treatment for post-concussive symptoms. And the thing that we like about the mindfulness meditation, about this cognitive behavioral therapy, they are strategies and tools that we can really all use, and they're not specific necessarily to one symptom. So they can certainly potentially be helpful for, across a number of different symptoms that you may have. So again, I'll ask the question, how many people in the audience are familiar with cognitive behavioral therapy or have had cognitive behavioral therapy? A few people? Okay. So cognitive behavioral therapy, it's a type of psychotherapy. And it's basically sort of the underlying theory is that the way that we think about ourselves, so negative thoughts about ourselves or the world, it's taking a look at those things. And if you look at the little diagram, it can become a bit of a vicious circle. We have, the world that we live in, and then we have thoughts. So we have constant thoughts running through our head all day, as probably everyone knows. And the idea is that those thoughts can actually impact a lot of different things, including our physiology and what's happening in our bodies. So we may have a thought about something about ourselves, and that may then lead to a feeling, an emotion. That emotion may in turn lead to some sort of action or behavior, which can then feed back on one another. And obviously, cognitive behavioral therapy generally is, the idea is that we're tackling thoughts that are more negative and are leading to negative emotions. So the idea is that it's really teaching us to sort of identify how we're thinking about things and to start to become more aware of that. And by changing our way of thinking, we can then actually change our way of feeling and our way of behaving and our way of feeling and functioning overall. In terms of the research evidence to support cognitive behavioral therapy, there's a lot of it. It was initially developed to treat depression, and it's been well documented to be effective in the treatment of depression, but has since been shown to be effective in a number of different types of disorders, so anxiety disorders. There is actually CBT for insomnia now, which has been shown to be quite effective. It's been helpful in substance abuse problems, eating disorders, and a range of different other difficulties. So this is a very, very quick overview of cognitive behavioral therapy, and you will actually find one of these thought records in your handout. And so I'd encourage you to take a look at it over the next week. This is sort of the basis if you're engaged in cognitive behavioral therapy, you'll be sent home with these sheets and asked to do this type of work at home. And basically the idea is, you'll see that the first column is a situation. So you would jot down the situation. So in this situation, it's Monday night, it's 2 a.m. This individual's lying in bed, staring at the ceiling, can't get to sleep. Next, what you're asked to do is to rate mood and how you're feeling. So in this case, the person is feeling frustrated, they're feeling anxious, and they're also asked to rate how frustrated and how anxious they are on a scale of 0 to 100. The third step is to identify what is going through your mind. And so in this case, it's, I'm never going to fall asleep. If I don't get to sleep now, tomorrow's going to be terrible. I'm never going to get better. So the idea then is to pick the one thought that is really driving that emotion. So if you look at those emotions of feeling frustrated, of feeling anxious, if you haven't been sleeping since your concussion, you've got to get up for work in the morning. What is the one thought that is really driving those negative emotions? In this case, so the person is circled, I'm never going to get better. What then happens is, and again, this is very quick, and it wouldn't be done this quickly in a therapy session, but this is really just to give you an overview. But the idea is then to start looking for evidence, and we term that the hot thought. So the hot thought is that one thought that's really driving those negative emotions. So what you're asked to do, and what you would do in conjunction with your therapist, is to find evidence for that hot thought and against the hot thought. So in this case, this is the fourth night that this has happened this week. This is just one of my many post-concussive symptoms that I have to deal with. And then you flip over and you say, okay, is there any evidence against that thought that I'm never going to get better? Well, some of my symptoms have disappeared, and actually most have gotten better. I had more difficulty sleeping last week, and I've also been nervous about an upcoming appointment. So you can see that in doing this, you're sort of trying to come up with a more balanced alternative thought, which is the long-term goal here. So even though I still have some symptoms, things are getting better overall. And you're also asked to rate how much you believe that, because obviously you may not believe that 100%. So you're asked to actually rate that. The second one was, I do have trouble sleeping, but there may be other factors contributing beside the concussion. And then you're asked to re-rate your mood. So that's just a really, really quick overview, but it's something, again, that has shown to be quite effective in things like sleep and mood. And those are certainly some of the symptoms that often follow concussion. So you may want to try it over the course of the next week. If you have a situation where you notice, a sudden decline or change in your mood to a more negative state, maybe pull it out and give a little bit of thought as to what may have been running through your head and work through that. The other thing that we've also just wanted to highlight is concussion in the media, and because obviously there's been a lot of attention to concussion over the past several years with sports-related concussions and that kind of thing. So it's really important to be cautious in your interpretation of what you're finding in the news, on the internet, and not always believing everything that you read. You really want to look at the evidence, because there's still a lot that we don't know about concussion, and there's a lot more research that is needed. So in terms of symptom management, there really at this point in time, as I indicated at the beginning, there is really no evidence-based treatments at this point. We really have only guidelines, and there's no magic bullet. The Ontario Neurotrauma Foundation came up with some guidelines for treatment of persistent symptoms post-concussion about 3 years ago. And the idea behind these guidelines are, and what they've done is really to take it symptom by symptom, so things like headache, mood symptoms, sleep, dizziness, sort of the big ones that they see, and then there are guidelines in terms of treatment. So these are geared towards healthcare professionals that are seeing people, and those are sort of the best things that we have to go with at this point in time. In terms of symptom management, immediate management, which I'm assuming everyone probably in this room is well past this, but typically there's a short period of where rest is recommended. Used to be the case, I think, that the longer periods and staying in a dark room for long periods of time was recommended, and that is no longer the case. But rather sort of a rest initially and then gradually increasing activity. And for longer term management, it's really what is encouraged is for people to gradually try to get back to what they were doing as they're able to, dependent on their symptoms. So some of the things when we're working with people with persistent symptoms, a lot of it is really very common sense, but worth, I think, stating. Just engaging in really good self-care. So things like nutrition, your diet is important, physical exercise, getting enough sleep, pacing yourself. You may not be able to, sit at your computer for what you did before. You may have to take much, more frequent breaks. If there are emotional symptoms, then psychotherapy may be helpful. Also, keeping a notebook or a diary to actually set goals for yourself, to record your progress, and log your achievements, because sometimes it can be a frustrating course when, especially if things are up and down, but if you're keeping track of things, it psychologically can help to see that there is some progress. And certainly social support is important also. And we've certainly heard that through the workshop, that even, being in a room and being able to speak to other people that have been through something similar has been helpful. And again, in the resource section of your handout, we have listed some different organizations that are starting to run groups and that kind of thing. So the one thing that we also wanted to mention, and there are some studies coming out of the University of Buffalo that have looked at physical exercise. So physical exercise, as with many other things, seems to be one of the things that really has been shown to be effective in helping people recover more quickly. And they're specifically looking at individuals with persistent post-concussive symptoms. And what they typically do is have people exercise just to sort of, because often what will happen when people exercise is it actually brings on symptoms. So they would have people exercise just to the point where, before they're coming on, and then they would gradually increase that physical exercise. And they hypothesize that it has something to do with cerebral autoregulation in terms of blood flow, but they're definitely getting some positive results. And we have actually had a few people that have attended the workshops that have found exactly that and have put themselves on an exercise program and just slowly increased it, and actually are seeing improvements in their symptoms. In terms of, this is again where we just, want to emphasize that there's no definitive evidence for many different types of treatments that we hear about or that we're asked about over the course of the time that we've been doing this. Concussion-proof helmets at this point, as far as I know, we don't have any yet. Certainly you should still wear a helmet because helmets will protect you from more severe injury. But in terms of actually stopping your brain from jiggling around if you fall and hit your head. It's still going to do that. Hyperbaric oxygen is something that we've heard of people trying, different types of medications, herbal remedies, nutritional supplements, acupuncture. I mean, there's a little bit of research in some of these areas, but at this point, not definitive support. And finally, just in terms of prevention, the Parachute website, which again is in your resource section, is a great website that has some really good resources and things that you can check out. But certainly just while you're still symptomatic, really important to exercise caution in avoiding anything that's going to put you at risk for falling, for hitting your head again. Avoiding alcohol, recreational drugs, typically recommended as well, certainly while you're symptomatic.